would reduce quality. I mean, if you go to Canada and you look for a Mayo Clinic or a Medtronic, they're not there. And the reason is that system doesn't work. And Al Franken, again, he has said several times over that his plan is to get to a single-payer government-run healthcare system. He wants to raise taxes and drastically increase spending and increase the size of government and let the government be the ones who are running your healthcare. Norm Coleman doesn't think that's the right vision. And regardless of who is president and what plan comes forward, Norm Coleman's going to fight for the priorities that he wants in a healthcare plan. He put his plan forward. I think some of you were probably there when he put his plan forward a few months ago. Be happy to walk you through that. It's a pretty comprehensive plan that would, level the playing field for folks between private and non-private health insurance, and it's a series of steps, and I can get you guys a background on that. But again, I think what Al Franken is doing here is not talking to Minnesotans about the vision that he has versus the vision that Norm Coleman has, and ultimately leadership is about doing what you think is right and working with whoever presents a plan to get that done.
But what about, if he's saying he will potentially abandon some things that maybe he had been supporting in favor of the presidential candidate and his party's plan, what about the question about Senator Coleman, supporting the McCain plan, and McCain presumably sort of the leader of the GOP nationally?
Well, again, Mark, I think that what it comes down to is fighting for what you believe should be in a plan. And again, I think that Norm Coleman has laid out a pretty clear vision of what his healthcare priorities are. And I think that Al Franken trying to not talk about where he stands is simply a lack of leadership and a lack of being honest with the people of Minnesota about where he stands. It's not this race isn't about, the Senate race is about Norm Coleman. It's about Al Franken.
Okay, but just to clarify, he's saying where he stands is where Barack Obama stands right now, and I guess I'm just trying to figure out whether where Coleman stands is aligned with Senator McCain.
Well, Senator Coleman's aligned with Senator Coleman's plan. And I think that's the point that I want to make here. I think that, again, if you look at Senator Coleman's plan, he has a plan that would make sure everyone has affordable access to health insurance, that we'd promote more responsibility, that we'd enact medical liability reform. Again, a series of steps of things he's been working on throughout his time in the Senate. And I think that, again, Al Franken is missing the point here. What Minnesotans should choose between in the Senate race is the vision of the healthcare plans for both candidates.
But Senator McCain's bill came up for a vote. How would Senator Coleman vote on it?
Well, I think, again, it would depend what was in the bill. Norm Coleman would work with whoever's working on the plan. Norm Coleman would be in there. He'd be a part of the debate. Al Franken, again, is sounding like he'd rather stand on the sidelines and let someone else make the decision. Norm Coleman would be in there as he has been on this issue, and he'd keep working on it.
We're having some interference with the sound, sorry. That's what the
what
looks are. It's not you.
Maybe my coat or something.
But one more stab. Do Senator Coleman's sort of priorities sort of line up with what Senator McCain is proposing, or not? Or do they differ from what Senator McCain is proposing?
I'll get you the breakdown of what they both look like. I think I'm sure there are some things that line up. Mark, they're both pretty comprehensive plans. I'm sure there are some things that line up from Senator Obama's plan as well. Again, I think that the point here is that the choice in this race is between the plans and the visions of Al Franken and Norm Coleman. And that's what people need to decide on, and again, I'll be happy to walk you through it all. It's pretty in-depth. I could stand up here for a while if you want, but we can certainly look at both of those.